To better understand the scale of this problem and what needs to be done to avoid a medical disaster, let me turn to Dr. William Schaffner. He's the head of the Department of Preventive Medicine at Vanderbilt University's Medical Center. He joins us from Nashville. Dr. Schaffner, welcome.
Welcome, Asieh.
How concerned are you about the findings of this report?
They're very, very concerning. We infectious disease doctors and public health people have been concerned now for years that we are overusing antibiotics to the point that the bacteria whom we would like to treat when you get sick are resistant. So we don't have antibiotics left that will work. This is a growing problem.
That is a big problem. And of course, this report follows one from Chinese scientists who say the last line of antibiotic defense has already been broken. And that antibiotic, I believe, is colistin.
That's it. Colistin was an antibiotic to which the bacteria had not been previously resistant in this special way. It now is. This resistance can spread to other bacteria because of this scientific evidence. So that brings the problem all the more to the fore. We're using too much antibiotics in people and also, as the piece said, in animals where it's used to promote growth. And then if the animals develop resistant bacteria, they can be transmitted to us and make us sick, and then we won't be able to treat you with an antibiotic that works anymore.
Dr. Schaffner, is there any other way to treat these sick animals without using antibiotics?
It's not so much that we're treating sick animals. We're using antibiotics in very low doses in order to make them bigger and fatter more quickly. So there's a great economic reason for the agriculture industry to use these antibiotics.
Understood. I thought it was both, when they're sick as well as to make them bigger.
True, both, but the large volume of antibiotics is used as a growth promoter.
Understood. So if us humans become resistant to antibiotics, what does it mean for doctors? What does it mean for their patients?
Well, we are looking at an antibiotic winter where we may be in a position where we have very few antibiotics that are left that work, and sometimes we have bacteria that are resistant to virtually all of the antibiotics. So we need to do two things. We need to set up incentives so the pharmaceutical manufacturers make newer antibiotics that will work, but we all need to discipline ourselves to use antibiotics much more carefully.
I want to ask you a question about what Jim O'Neill said in the piece before we came to you in Richard Bestick's piece. He said, if nothing is done about the misuse of antibiotics, by 2050, the problem, it's going to affect 10 million people. Your reaction to that?
I heard that number. That's the largest such number that I've heard before, and it's very ominous. We're struggling with this problem already in my hospital. This will spread around the world and cause people, even in the developing world, to have problems with antibiotic resistance.
And very quickly, Dr. Schaffner, I'm a mom. We talk amongst ourselves with a lot of other moms, and when our kids get sick, if it's strep throat, if it's a bacterial ear infection, can those problems be fixed without going on antibiotics? We're very eager to just get them on some kind of treatment so they're well.
Well, most of the time, those infections are due to viruses. And viruses are not affected with antibiotics. And if your pediatrician says it's a viral infection, you don't need an antibiotic, don't argue with the pediatrician. Be happy.
All right.
And you can get symptomatic treatment for your child.
Very understood. Thank you so much, Dr. William Schaffner. We appreciate your time and your expertise.